Hello everyone, my name is Jave Bowden and I want to go into labor and delivery, and my team is Team 6. So since most of our team members were actually interested in working in the emergency department, we ended up choosing burns for our CPG topic since that's a condition commonly found on the ED unit. And our CPG focuses on how nurses and healthcare teams can work together to manage fluid resuscitation in burn patients. And we just want to break our CPG down and explain how it can be used to improve the quality of care for patients with serious burns.
Hi, my name is Madeline, and some of my clinical interests consist of the emergency department and the NICU. For our CPG, we looked at the American Burn Association's 2024 guideline on burn shock resuscitation. This CPG covered patients that had burns covering 20% or more of their body. Because of this, these patients are at a higher risk for fluid loss. And this guideline gives advice on how to safely give IV fluids during the first 48 hours after injury to prevent complications.
Hi, my name is Precious and I want to work in the emergency department. I'll go over the main problems that the guideline addresses. The biggest concern is that giving too much fluid can be just as dangerous as not giving enough. This is something they call fluid creep. It can lead to complications like pulmonary edema and kidney damage, as well as longer ICU stays. So the guideline helps us find the right balance so that we can avoid these complications.
Hi everyone, my name is Anna Hall and I am interested in working in the emergency department. So one big thing our guideline is trying to push for is to change the fluid formula from 4 milliliters to 2 milliliters per kilogram per percent of total body surface area, in hopes to essentially not fluid overload the patient. So this guideline also suggests giving albumin, which is a protein that can pull back blood from the blood vessels to improve blood flow. Our PICO question is basically looking at whether giving albumin earlier rather than later helps in things like fluid overload, urine output, or swelling. And then we chose this because there's still some debate as to what the proper timing is to give fluids, and then it's also just very relevant in nursing care in general.